Infectious disease specialist Dr. Zain Chagla joins us now with a COVID-19 update. And let's talk about the Omicron wave, because we're hearing people say, oh, it's almost over, but then we're seeing hospitals still being overwhelmed.
Yeah, absolutely. So, I mean, the science table gave us some pretty staggering numbers in terms of how many people got infected in this last 2 months. The estimates are 1.5 to 4 million people. That's 10 to 30% of the Ontario population getting Omicron in the last 2 months. And so that's going to have effects, right? That means that health services shut down. That means that individuals who are very frail are still at significant risk, even with mild illness. And we're seeing the effects of that. Unfortunately, again, healthcare is where these people are accommodated. Pressures are already high in the wintertime, and we know that hospitalizations lag behind that peak of illness quite a bit. And even on that way down, it doesn't mean that people are not being hospitalized, right? It just means that there's less cases today than there are tomorrow. It doesn't mean that there are zero cases tomorrow. And so we're still seeing those people who got infected after the peak end up in hospital. And again, that there's only so much that can be accommodated at the healthcare level.
And there's more people dying. Like, we see the death counts rise every day. A lot of them are accumulated from a number of weeks. But anecdotally, you hear from people who've had Omicron, and it was like, oh, it wasn't that bad. But then it's like, well, it must be if it's.
Yeah, absolutely. Look, there are populations where, even mild illnesses can push people over the edge, people that are frail, elderly, people that are, compromised. And I think, again, this is just also a reflection of the sheer numbers here. In our prior waves, say the alpha wave last year around this time, February, March, when we were seeing high deaths, we were talking about tens of thousands of people being infected, maybe 100,000 to a few 100,000 at max through that whole period. Again, we're talking about millions of people being infected here all at once. And so, yes, there is an absolute number of deaths that's larger than it has been before. Relative to the amount of population that's been infected, it is small. But again, that small percentage of a large number is still a large number at the end of the day.
Dr. Kieran Moore, the Chief Public Health Officer for Ontario, has said that, we're going to have to live with this and learn to live with it. He's talking about masking, probably going to continue on for quite a while. Is this going to be something that, yes, it's just going to be prevalent?
Yeah, absolutely. Look, again, we've seen just a significant amount of population infected in 2 months. There are more susceptible individuals out there, and so we're going to likely see more individuals get this. We don't know what the variants bring. This virus is going to continue to evolve, and we know our vaccines are incredibly effective at keeping people out of hospital. But transmission is not perfect, and we do see people with 2 and 3 doses that can transmit the virus to others. And so, I think this all means we have to figure out how to live with this, and particularly looking at rules and regulations that may not necessarily focus on having more global impact or large impacts, and really don't do a ton. We change the isolation rules. I think there's a good look at things like travel, where it's not really an effective policy. But then looking at things like masking and work from home, which are actually simple interventions which likely have some control, and using those more effectively as compared to, individual punitive measures.
Britain's approved a 5th vaccine, Novavax. Do you think, what are your thoughts on that?
Yeah, so I mean, that's great. We're going to hear, I think the application was actually submitted to Canada some time ago, and this is an effective vaccine. Don't have a lot of Omicron data yet, but at least effective in the Delta era. It's a protein-based vaccine, so many people with their hesitations towards mRNA technology could be considered for this vaccine. People who had reactions to mRNA vaccines could be considered to this vaccine. More options are better. It may help with the global supply chain as well. And this is the one that actually may have a manufacturing facility in Canada. So, as this gets approved, and hopefully newer versions of this vaccine get approved with variants, we actually may have some local support to be able to build this in Canada as compared to importing it from abroad.
Okay, Dr. Zain Chagla, thank you for your update this week. Again, always nice to see you.
No problem. All the best.
Okay.